afternoon, New Brunswick, and welcome to today's COVID-19 update for the province. We'll be hearing from Dr. Russell today, as well as Minister of Education Dominic Cardy. I am Vicki Hogarth at the CHCO News Desk. We did just get word from Bruce that we should be starting in really just under 2 minutes. So I'll do a quick recap of the numbers. There were 9 new cases yesterday. 6 were in Zone 1, that's the Moncton region. 3 were in Zone 3, that's the Fredericton region. Now, we do know from news that just broke within the hour that there will be an announcement in today's conference that vaccine eligibility has now been opened up to New Brunswickers who are age 12 and over. Now, what this means, it was a question that we asked in the conference yesterday on behalf of CHCO viewers, what that will mean potentially for vaccine clinics that could take place in schools during the school year. We also do know of news this week that was announced that Health Canada has approved that Pfizer can be stored in refrigerator temperatures for up to a month. What we thought before was that it had to be at very cold temperatures, and that was the reason Minister Cardy gave last week for potentially not doing clinics at schools due to the temperature levels that Pfizer needs to be kept at. And again, that is the one vaccine that's approved in Canada to be used on individuals who are 12 and over. So now that we do have this change with Health Canada, there could be some news today that we find out. Now, Bruce is in the conference room, so we should be starting any minute. So I do expect that they will address that today, whether they have any news on vaccine clinics or not, and how that will go. We should be hearing within the next couple of minutes. Actually, here's Bruce. I'll join you after.
Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honourable Dominic Cardy, Minister of Education and Early Childhood Development. Les porte-parole aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'Honorable Dominic Cardy, Ministre de l'Éducation et du Développement de la Petite Enfance. Dr. Russell.
Bon après-midi à toutes et à tous. Good afternoon, everyone. When you have been on a long journey, as we have been throughout this COVID-19 pandemic, it is natural to be focused on getting to your destination. But we should also consider what life will be like once we get there. COVID-19 will not disappear overnight. It will still be with us for some time. Il y aura des éclosions. De nouveaux variants pourraient faire leur apparition. La reprise des voyages à l'échelle internationale comme avant de la pandémie fournira au virus de nouvelles occasions de se propager. So even when we have our population fully vaccinated, the virus will still not go away. We do know that globally there are countries that will lag behind with respect to vaccinations. And as vaccination rates rise here in Canada and in New Brunswick over the summer, we do expect the number of infections will decline. Outbreaks will be smaller and easier to control. Now, all that is relative. In Atlantic Canada, we've been really fortunate to keep our case numbers low, comparatively speaking, to the rest of Canada. So the difference won't be as dramatic compared to other provinces who've had very high numbers of cases and negative outcomes. Moins de gens deviendront gravement malades de notre système de soins de santé sera en mesure de s'occuper de ces cas. Nous avons toujours eu comme objectif de gérer la COVID-19, de protéger notre système de soins de santé et de réduire la menace que ce virus pose pour la population du Nouveau-Brunswick, et cela sera possible avec notre programme de vaccination. That threat will not disappear entirely, but we will be able to live with it. And again, key to our success will be our level of vaccination moving forward. For the present, we are focused on staying the course. Getting New Brunswick to the green alert level in our recovery plan will take longer and be more difficult if we fail to keep on the path that we are on. We must all continue to follow public health guidance and advice, with particular attention to those actions that limit the spread of the virus. Washing your hands regularly and thoroughly is very important right now. It's also a good idea to use alcohol-based hand sanitizer between washings to remove any viruses that you may have picked up. wearing a mask, wearing it properly, maintaining 2 meters of physical distance, staying home when you feel unwell. All of these actions will help us to stay on our course to a more normal life. Il est également recommandé d'utiliser un désinfectant pour les mains à base d'alcool pour éliminer toute trace du virus avec lequel vous auriez pu entrer en contact. En portant un masque et portez-le une bonne façon, en nous maintenant à 2 mètres, autres et en demeurant à la maison. Si nous ne sentons pas bien, nous garderons le cap sur la voie nous menant à une vie plus normale. Aujourd'hui, Santé publique confirme qu'il y a 10 nouveaux cas de COVID-19 au Nouveau-Brunswick. Il y a 6 nouveaux cas dans la zone 1, soit la région de Moncton et du sud-est du Nouveau-Brunswick. Les 6 cas sont des contacts de cas déjà confirmés. Dans la zone 3, soit les régions de Fredericton et de la vallée de la rivière Saint-Jean, il y a 4 nouveaux cas. 3 de ces cas sont des contacts de cas existants, alors que l'autre est une personne qui a contracté la COVID-19 à la suite d'un voyage et qui s'isole à l'extérieur de la province. Nous signalons aussi aujourd'hui un cas de transmission communautaire dans la zone 3, soit un cas pour lequel nous n'avons pas pu lier l'origine de l'infection à un autre cas confirmé dans la région. Cette situation est inquiétante car jusqu'à présent, nous avons été en mesure d'établir un lien entre tous les cas dans cette zone. Nous croyons que ce cas met en cause une souche différente du virus et n'est pas lié aux autres cas de COVID-19 confirmés dans la région de Fredericton. Today, Public Health has confirmed 10 new cases of COVID-19 in New Brunswick. In Zone 1, which is Moncton and Southeast New Brunswick, there are 6 new cases today, and all of these are contacts of previously known cases. In Zone 3, which is Fredericton and the St. John River Valley, there are 4 new cases. 3 are contacts of existing cases, and the other is a person who contracted COVID-19 through travel and is isolating outside the province. We are also today reporting a single case of community transmission in Zone 3. This is an infection that we cannot trace to other cases in the area. Now, this is concerning because to date we have been able to link virtually all the active cases in that zone. However, we do believe that this case is a different strain and not related to the other cases of COVID-19 now present in the Fredericton area. We now have 134 active cases of COVID-19 in New Brunswick. This includes 10 cases currently outside of the province. There are now 6 New Brunswickers in hospital due to COVID-19, including 2 individuals now in intensive care, and this includes 1 person hospitalized in another province. All New Brunswickers dealing with the impact of COVID-19 include more than 1,100 people who are self-isolating at this time and who need your support. I ask that you continue to keep them in your thoughts and prayers as you go about your day. Our vaccine program continues to gain momentum. And while we remain focused on getting a first shot into as many New Brunswickers as we can, as quickly as we can, we are also moving ahead with second doses in priority groups. We have prioritized second doses for residents and staff of long-term care homes because we have seen how vulnerable people living in these settings can be to this virus. Je suis heureuse d'annoncer que nous terminerons plus tard cette semaine les cliniques de deuxième dose pour tous les foyers de soins et foyers de soins spéciaux au Nouveau-Brunswick. Je suis convaincue que les résidents et leurs familles pousseront un soupir de soulagement, sachant qu'ils jouiront désormais du plus haut niveau de protection possible contre la COVID-19. I am pleased to report that we will complete second dose clinics for all of New Brunswick's nursing homes and special care homes later this week. And I'm sure that this will be a relief to residents and their families, knowing that they have the maximum level of protection against COVID-19. I would also like to remind those who had the AstraZeneca vaccine as their first dose earlier this spring that there is an opportunity to receive a second dose before the end of this month. And while we are not using AstraZeneca as a first dose for the general population, we will continue to use it for people over 55, particularly those who are unable to get a vaccine at an RHA clinic or pharmacy. We still have a supply of AstraZeneca vaccines that will expire at the end of this month. So if you are over the age of 55 and had this vaccine as your first dose, you can immediately receive a second shot from this supply. You can register online for a clinic offered by Horizon or Vitalité Health Networks or through a participating pharmacy. If you decide to wait for another product, you will have an opportunity for your second vaccine within 16 weeks of your first shot. Public Health is awaiting guidance on which products are most effective in those circumstances. We now have more than half of our population with at least one dose of a COVID-19 vaccine. In the weeks ahead, we will be providing second shots that increase the level of protection. As the level of protection goes up, the level of restrictions should be able to decline. And as you know, in New Brunswick and Atlantic Canada, we've had really stringent measures in place throughout the pandemic. And as we get more people vaccinated, the bulk of the work will really be being done by the vaccination itself. So even when we get to the green level, the virus won't disappear. We will still have to look out for ourselves and care for one another. Cette pandémie nous a appris de nombreuses leçons. Mais la plus importante, c'est que nous avons en nous une énorme réserve de gentillesse et de compassion qui nous permettra de surmonter ces moments difficiles. This pandemic has taught us many lessons, but none greater than this, that we have a tremendous capacity for kindness and caring that will enable us to get through difficult times. We will have the strength to call upon whenever we need it as we continue to live with COVID-19. Thank you very much.
Good afternoon, everyone. Bon après-midi, bienvenue. So last night we did have a third positive case of COVID-19 confirmed at Priestman Street School here in Fredericton. And as usual, the school community was notified. Public Health has directed students, staff, and their families to extend their self-isolation period until 11:59 p.m. on Friday, May 28th, to allow for contact tracing to be carried out. And students will engage in distance learning for the remainder of the week. While I know that anxieties are high in the Fredericton area, I want to reassure families and let them know that no in-school transmission cases have been determined in connection with these three cases. Last night, we also heard that a possible exposure to a positive case of COVID-19 was confirmed on bus 210, carrying students to Fredericton High School and to George Street Middle School on the mornings of May 18th, 19th, 20th, and 21st. So any students who were on bus 210 on those mornings between May 18th and 21st and their families have been directed by Public Health to self-isolate for 72 hours as contact tracing is carried out, and then to self-monitor for 14 days. We are strongly encouraging students and staff at Priestman Street School and students who were on bus 210 to get tested over the next few days. I know that many families have had questions as to why we've had different responses as a system to different cases in different schools and in early childhood education centers over the last months and over a year now. And the answer there is because each situation is different, each school is different, and every time that we see a case, we try and deal with it appropriately based on those specific circumstances. So our outbreak management plans, which have been developed to minimize the risks to students and staff and to support contact tracing, have been designed tailor-made for each school, and each time an outbreak hits a school, the response is tailor-made as well. So what that means is that when Public Health evaluates each situation on a case-by-case basis, and then they undertake calculated risk assessments and determine the best course of action. And this has so far proven to be very successful, thanks to the work of the contact tracers, thanks to the work of the folks at Public Health and at EECD and at the Department of Health, and all the other folks who have helped out over the last year and a bit, and the citizens who followed the rules that Public Health has laid down for all of us. We know that school is incredibly important for our students, and we want to make sure that we can, to the greatest extent possible, minimize the disruption to the day-to-day lives of our students. So we know that there are lots of kids who are depending on the programs that are provided that are in schools to make sure that they can stay healthy and happy and safe. And that's our goal as well. So, as always, there will be no hesitation from my part to close down schools should the need arise. But our back to school plan, our return to school plan, which was put in place last year for the whole province, was developed to keep schools open and safe even when a small number of cases were confirmed. And I was saying that back, I think it was about a year ago now. I said, we have to expect more cases. We have to expect some serious cases. This is always about managing a pandemic, not keeping it completely away, although we've done a great job as a province in doing just that. So similarly, our return to school plan was designed to align with public health's alert levels, and we're going to continue to follow their advice and work with the schools and the districts for the last few weeks of this school year. And it's another opportunity there, which I'll take to really thank the school, the district, and public health staff for reducing the impact on our school system over the last days. We have only lost 28 operational days in 48 schools across this school year. And that's a record that is unparalleled in most of the world. And it's because all of those folks I just mentioned, and the students, and the parents, and the people who support those families also did the right thing. And that's let us have as close to as possible a normal school year for our students in the face of a pandemic that in many parts of Canada has shut down schools for weeks or months. Sometimes schools closed for months and then reopened again the next day for a single day and then closed again, as happened in the UK earlier this year. So we have a lot to be thankful for, and I'm incredibly grateful to all of those staff, from the bus drivers, the custodians, and everyone else for the sacrifices they've made, the extra work that they have put in to keep our students safe. Remember, as always, if you've got a family member or if you've been identified as a close contact, public health is going to be in touch with you directly as part of contact tracing. So please follow the directives that they give you and remain vigilant and be ready to answer your phone if public health calls. Actually had someone emailing me about this, asking if public health's number came up on the screen. So yes, please do answer your phone when public health calls you. So have your ringers on if you're at all worried, and hopefully again this next few weeks will be the last time we have to worry about these sorts of things and we can go back to ignoring our phones as usual. If your phone doesn't ring, that's good news. Aujourd'hui, j'ai l'immense plaisir de vous faire part de quelques nouvelles qui, j'en suis sûr, favorisent une année scolaire plus normale lorsque les élèves reviendront en septembre. Étant donné qu'un plus grand nombre de vaccins sont disponibles au Nouveau-Brunswick, nous élargissons dès maintenant l'admissibilité aux jeunes de Nouveau-Brunswick âgés de 12 à 17 ans. Les jeunes de 12 à 17 ans peuvent prendre rendez-vous pour recevoir le vaccin Pfizer-BioNTech. Pour les jeunes de moins de 16 ans, le consentement d'un parent ou d'un tuteur sera requis. So, those aged 16 and older, or the parents or guardians of someone aged 12 to 15, can register for an appointment at a participating pharmacy or through the clinics provided by the Vitalité or Horizon Health Networks. And you can book your appointments online at www.gnb.ca/book-a-vaccine, all one word. If you can't book online, or couldn't understand what I was just saying, you can call 1-833-437-1424. 1-833-437-1424. S'il vous plaît, veuillez être patient, car les vaccins arrivent progressivement et la disponibilité des rendez-vous peut varier. Davantage de rendez-vous seront disponibles la semaine prochaine ou la semaine suivante. We have worked very hard to support public health in their plans to vaccinate children 12 years of age and up, and to ensure that their families are well informed. And in the coming days, our province's 7 school districts will be sending out information that will help guide parents through the registration and vaccination process. And our goal is to provide parents with efficient access to information so that much like the vaccine, the registration process is quick and painless. We know lots of people have been curious as to why we're taking this approach instead of vaccinating children in schools. And I can say that was certainly the first question I asked. We did look at lots of different options, but because the Pfizer-BioNTech vaccine is the only one currently approved in Canada for use in children as young as 12, it presents a lot of logistical difficulties to have vaccine clinics in schools. It's a vaccine that, as of right now, has to be stored at very, very cold temperatures. Transporting it is difficult. And of course, we've got limited staff able to administer the vaccines, and a lot of those folks are already working on vaccine clinics elsewhere. So we looked then at busing students from school to their local clinic. But then we realized that every community across the province has so many different challenges that would again present a logistical challenge that would outweigh the benefits. So to ensure that we're working as hard as we can to support public health and making sure their resources are allocated as efficiently as possible, we decided we did not want to fragment them or impose a blanket approach. Comme nous savions que des autorisations parentales spécifiques seraient de toute façon requises, nous avons voulu inviter les parents à se joindre à leurs élèves lorsqu'ils viennent se faire vacciner. Ainsi, un parent sera sur place pour toute l'information, pour toute information nécessaire, et nous pourrons minimiser le nombre de rendez-vous manqués ou de feuillettes d'autorisation perdues. We're also strongly encouraging that a parent who is yet to be vaccinated go in and get your shot at the same time as your child. Show our children that they have a chance to play an important role in getting our province back to pre-pandemic life. Because the sooner that our population is vaccinated, as Dr. Russell said, the sooner we can return to normal. And that includes returning to a more normal school year. We all want schools to be able to return in September with the same openness for sports and activities and friendship and togetherness, and an end to distancing, an end to masks, an end to the restrictions that we're all fed up with. And getting vaccinated is an important step towards us achieving that goal. I do understand that there are concerns as well around children under 12 who cannot currently access any of the available vaccines. Hopefully that's going to change as the science around the vaccines accelerates, but it's yet another reason why it's so important for all of us who are able to get vaccinated to go and get that shot. And we've seen New Brunswickers taking up that challenge with incredible enthusiasm, and it makes me proud to be a citizen of this province. But please, parents, grandparents, guardians, book an appointment for your child. Get them vaccinated to protect them and to help protect our schools and keep them healthy, safe, and open. Les vaccins contribuent à vous protéger, vous et les personnes que vous entourent. Plus le nombre de personnes vaccinées contre le COVID-19 est élevé, plus il est difficile pour le virus de se propager. Cela permettra de préserver des vies et d'obtenir la levée des restrictions. The fact that we've been able to reach this point in our vaccination rollout by late May is something, again, that we should all be proud of. It's a testament to all the hard work that's been going on behind the scenes. And again, want to repeat my thanks to everyone who's helped make that happen. We have incredible staff across the province who've come together and pitched in, and they've helped get us here, alongside all of you watching or listening who've done your part as well. Our nurses, our pharmacists, public health workers, working just endless hours to support this rollout. So for everyone who signed up, rolled up their sleeve, gotten their shot, thank you. By working together, we are protecting our loved ones, our communities, and our province. So let's make 2021 a year that we will never forget, hopefully never repeat. Let's make it a year that we won't forget, though, for some of the right reasons. Let's think to the future. Hopefully just a few weeks, most months from now. We can take off our masks, hug each other again, go to live concerts, enjoy music, enjoy being outside, and let's never again take for granted some of those freedoms that we've had to be seen restricted over the course of the last year and a bit, for all the right reasons, but hopefully never again. And let's also not never again take for granted how beautiful our province is and how much we value our friends and neighbors. Nous sommes presque à la fin. Nous ne relâchons pas maintenant. S'il vous plaît, comme toujours, suivez les conseils de la santé publique. Aidez à la recherche des contacts en notant où vous avez été et portez votre masque pour quelques semaines encore. Lavez-vous les mains et gardez vos distances. Together, we can push through this. It's just a little bit longer, long way down the road, and the finish line's in sight. Thank you. Merci.
Merci beaucoup, Monsieur le Ministre. Dr. Russell, thank you, Minister and Dr. Russell. We'll now proceed with questions from members of the media. Each reporter will have 2 questions. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura 2 questions. Voulez-vous assurer désactiver le son de vos micros? Tim Roselle, Global News.
Thank you, Bruce. My first question is for Minister Cardy. Mr. Minister, if the information about the vaccination process is going to be sent out by school districts to families over the next little while, and if the plan is to not vaccinate students in schools, what is that information going to contain?
It's going to contain information about exactly how you can access the vaccines. A lot of the information that I just gave out in terms of here are your options for using pharmacists, for using the clinic set up by the health authorities, information as well on consent forms and how you can access those. So just the basic information that you would need to help you. I could compare it perhaps to the voter cards that get sent out, telling you where, when, and how. And the goal there is to have everything in one place for parents so they can quickly get themselves and their children vaccinated if they haven't had their shots already.
Your second question, Mr. Roselle?
Thank you, Bruce. My follow-up would be to Dr. Russell. Dr. Russell, does anything change at vaccination clinics, be they at a pharmacy or one of the RHA clinics, now that you're going to be in a situation where you have parents coming with their children to vaccination sites? Does anything change at those locations just logistically or anything like that?
Not that I'm aware of. I mean, the physical distancing will still happen, and obviously a parent with their child, they're in the same household bubble, so they would be able to stay together, I'm presuming. I do have a correction to make. There, in my notes earlier, I referred to people getting the second dose of their AstraZeneca vaccine. They can register to get their second dose if it has been at least 8 weeks from their first dose. That wasn't clear in my speech. And just coming back to the protocols around the vaccine clinics, whether it's in a pharmacy or an RHA clinic, making sure that, again, all the protocols are followed properly, being properly masked, and making sure that you're social distancing appropriately.
Thank you. Thank you, Mr. Roselle. Thank you, Doctor. Thank you, Minister. Alexandre Boudreau, l'Acadie Nouvelle.
Bonjour, ma question est pour le Dr. Russell. Je veux savoir si vous avez eu les résultats des tests de dépistage au foyer de soins Petit Bon Soin à Shediac, puis aussi si vous avez eu d'autres infos sur l'éclosion depuis hier.
Au niveau de la situation à le foyer de soins que vous mentionnez, je sais il y a un cas positif. Puis ça, c'est toutes les nouvelles que j'ai. Notre équipe de prompt est là. Alors, ils vont faire toutes les mêmes choses qu'ils font à chaque fois qu'il y a une éclosion à un foyer de soins au niveau de la collaboration avec les employés, les familles, les résidents, la Croix-Rouge, etc. Alors, ils vont tous travailler ensemble pour protéger tous les résidents.
M. Boudreau, as-tu un suivi? Une deuxième question.
Oui, ce serait pour soit M. Cardy ou la Dr. Russell. Je voulais savoir si vous savez, est-ce que la vaccination contre la COVID-19 va être ajoutée à la liste des vaccins que les enfants doivent avoir quand ils font leur rentrée à l'école pour la première fois, comme c'est le cas pour les vaccins pour la tétanos, la polio, la coqueluche, etc.?
Okay. Thanks for that question. À ce point, on n'a pas l'intention de l'ajouter. J'ai hâte de retourner pour le programme pour les vaccins dans les écoles en septembre, mais encore à ce point, cet vaccin n'est pas sur cette liste. Alors, on a une liste des vaccins mandatoires pour les élèves à l'école. Le vaccin contre le COVID, ce n'est pas sur la liste à ce point. Mais encore, on a vu un appui énorme pour le programme de vaccination lancé par Santé publique dans les dernières semaines. C'est quelque chose encore, je suis tellement fier de notre province et j'espère que ça va continuer dans la même direction et que la question de faire quelque chose de mandatoire va être assez irrélevant à cause du fait que l'énorme majorité de notre population appuie le système de vaccins et ont pris leur vaccin pour protéger pas seulement les autres, mais aussi leur communauté et leur famille.
Merci, M. Boudreau. Merci, ministre. Savannah Odd, Telegraph Journal.
Hi there. Dr. Russell, you had mentioned the community transmission case, and you had said it was a different strain from the one currently circulating in Fredericton, which I believe is the India variant. Could you clarify which variant this community transmission case was? And do you know how many close contacts they had, or contacts, I guess, in general?
Hi, Savannah. As of right now, the genetic sequencing that was done, I'm not sure whether it's actually the B1617 or a different variant. I'm not talking the variant here. I'm just talking that it's a different genetic sequence than whatever is circulating currently. And I don't know about close contacts at this point.
You have a follow-up, Ms. Odd?
Wait, I'm sorry. So you don't know, I guess, which variant that one is? Sorry, I'm not sure.
Right. Again, the information that I have right now is that the preliminary genetic sequencing that has been done already differentiates it from any of the circulating cases right now. That's all the information that I have. We will have more information on that. I guess I just wanted people to understand that we're not looking at a new case that has popped up that could be related to the cases that originated from the cluster at the Delta.
Right. Okay. And that is a different from the variants circulating in Zone 3, or for all of New Brunswick, and as well for Zone 3. If you can maybe just describe the transmission patterns and the settings where we're still seeing a lot of transmission happening.
So just coming back to that community transmission case, I will have more information on that. Again, the only point around the genetic sequencing was just to let you know that we had made sure that it wasn't linked to the original cases from the Delta and the B1617 strain that we know is associated with those cases and their close contacts, which I think is upwards of at least 75, if not more, cases by now. And so I don't have the information on the close contacts right now on that particular case of community transmission, but we will have more information on that. And your other question was around patterns of transmission around the province? That's your other question? I can just say that we in the Zone 1, that a lot of the cases that we were seeing there were the UK variant, so B117, and that's really all the information I have on the different variants right now. I do have some positive news, though, about Fredericton in Zone 3. The McGee House outbreak is declared over today by the Regional Medical Officer of Health.
Thank you, Ms. Odd. Michel Corriveau, Radio-Canada.
Oui, j'ai une question. En fait, c'est un suivi à la question d'Alexandre pour M. Cardy sur la vaccination obligatoire. J'aimerais savoir, M. le ministre, quel pourcentage vous attendez-vous à avoir de vaccination chez les élèves pour que ce ne soit pas nécessaire de le mettre obligatoire dans les écoles en septembre 2021?
Et merci pour la question. Ce n'est pas un cas d'attendre pour un pourcentage que ça va être mandatoire ou non. Il n'y a aucun plan à ce point pour le rendre mandatoire, mais on espère qu'avec notre cible d'avoir au moins 5 à 75% de la population vaccinée, j'espère qu'on peut surmonter ça avec le pourcentage des jeunes qui sont vaccinés et les membres de l'équipe scolaire. Jusqu'à ce point, on a eu des résultats assez incroyables. Je pense que c'était plus de 90% pour l'équipe scolaire au niveau secondaire qui est offert le vaccin quelques semaines passées maintenant. J'espère qu'on peut continuer en utilisant ce pourcentage comme inspiration.
M. Corriveau, as-tu une deuxième question?
Merci, Bruce. Oui, j'ai une deuxième question, probablement pour le ministre Cardy à nouveau. C'est dans le cas de l'autobus 210 qui transporte des élèves de Priestman, mais aussi de FHS à partir de Henwell, si je ne me trompe pas. Est-ce qu'il y a des mesures particulières qui sont prises du côté de FHS dans un cas comme celui-là?
Je veux juste préciser que c'était FHS et George Street, pas FHS et Priestman, juste pour préciser. Juste pour ne pas inquiéter l'équipe au Priestman. C'était les 3 écoles où j'étais étudiant. Je pense que je les ai déjà assez inquiétés dans les années 70 et 80. Pour les jeunes qui étaient sur l'autobus, c'est donc, comme toujours, attendre pour le contact de santé publique. Si tu es en contact avec la santé publique, c'est pour une raison. Il y a 115 étudiants qui ont reçu une lettre, les familles des étudiants qui ont reçu la lettre pour les informer qu'il y a un risque de contact et juste suivre l'avis de santé publique comme toujours. C'est juste une école, c'est juste une salle de classe sous les roues, alors c'est les mêmes politiques sont en place pour les contacts qu'avec une éclosion dans une école.
Merci, vous deux. Allison Sampson, CTV.
Good afternoon. My first question is for Dr. Russell. Could you please tell me the percentage of long-term care residents in New Brunswick and how many, residents and staff in New Brunswick have been vaccinated at this point?
Can you repeat that a bit louder, Allison, please?
Sorry, what's the percentage of long-term care residents and staff that have been vaccinated to date?
I'm just looking for that information right now.
And if you're perhaps, while Dr. Russell's
Sorry,
getting
I
that
did
information.
find it, sorry.
You got that? Okay.
Yeah.
I have something else I'll drop in afterwards.
Pardon?
I had something else on the public health
Oh, okay.
private line, but I can drop in afterwards.
So my understanding is we have 68.8% of long-term care facility residents vaccinated.
Your second,
And 45.5% of long-term care staff have received 2 doses.
Ms. Sampson, do you have a second question?
I do. I'm wondering, do you also have the numbers of how many people? I might have missed this off at the beginning, but how many people in Zone 3 are isolating at this time?
1,100 that's the latest number I have. 1,100.
Thank you.
Vicky Hogarth, CHCO-TV.
Thank you, Bruce. Dr. Russell, should children 12 and older with autoimmune conditions feel safe taking the vaccine?
On the product monograph, and there are contraindications, and some of those things parents can talk about with their primary care providers as well as specialists that are involved in their care. So that would be a decision that would be made with those types of conversations. But certainly at the clinics, the nurses are trained to ask questions about contraindications. So, but as of right now, those conversations need to take place with primary care providers and patients and specialists.
Do you have a follow-up, Ms. Hogarth?
Thank you. For Minister Cardy, are young adults aged 16 and 17 able to book appointments for vaccines without requiring their parents' consent? What is needed in New Brunswick for consent when it comes to vaccines?
That's a great question. And yes, that's it. It's those students from 16 and up, they can book their own vaccine appointments and don't require any permission from anyone else. And I wanted to add something in from my statement earlier because I think I was a bit unclear around answering the calls from public health. Answer those calls because they sometimes do come up as private numbers. So it's a good time to make sure that you do answer a call from a private number, even if that's not normally something that you might do.
Thank you, Ms. Hogarth. Thank you, Minister. Before we go to Bobby Jean, Savannah, Dr. Russell has one point to add.
So with respect to transmission patterns, obviously close contacts who live in a person's household are at the highest risk. But because with the variants, we do see transmission happening before a case is actually identified, we do see transmission happening in workplace settings. We also see transmission happening in workplace settings if people are not wearing their masks properly or at the appropriate times. And we're also seeing transmission in workplace settings when people go to their workplace with symptoms instead of staying home and self-isolating and getting tested.
Thank you, Doctor. Bobby Jean McKinnon, CBC.
Yes, thank you. Dr. Russell or Mr. Cardy, I know you've talked a bit about there being no students to student transmission, but do you have any information about how many COVID cases were contracted in schools and how many were contracted in home or elsewhere and brought to schools?
I do have some of that data here. Just give me 1 second. We've had, if I recall correctly, 48 schools impacted by COVID, and not too many more cases than that. I think the most we've had in a specific school has been around 3. So I can get you the exact breakdown of all that in terms of the precise schools and districts and so on, just if that would be helpful. But so far, in addition to not having transmission inside the school, we've had just very good luck and good planning and good execution of the plan that have kept the case numbers in those schools really low regardless of their origin. So hope that answers your question, and happy to get you the full list, which is obviously, because it's up close to 50, is quite a long one. So I won't read it here, but we'll get it off to you.
Okay, thank you.
Ms. McKinnon, do you have a follow-up?
Yes, I do. Dr. Russell, what was the origin of the Delta cluster, and could you give the breakdown of the number you cited earlier for, I think you said we're up around 75 now?
So the
Direct and indirect?
So from the index case at the Delta, there were 12 people who were either guests or patrons or, sorry, there's a mosquito bugging me. Of the 12 cases directly linked to the Delta, to the Delta index case, they were either guests or patrons or staff. And of those 12, those people have transmitted to close contacts, including household members, et cetera. And so the total number as of yesterday from that entire cluster was 75. But that number probably went up today because I know we had 3 new cases. I believe we had 3 new cases today.
Thank you.
I'm sorry, did you say, I didn't hear, did you say what the index case was?
I can't really elaborate other than there was an index case at the Delta and that the index case transmitted to either staff, patrons, or guests. And that included 12 in total.
Why can't you elaborate?
I'm trying to protect confidentiality while trying to not get bitten by a mosquito.
Thank you, Doctor. Thank you, Ms. McKinnon. Aiden Cox.
Good afternoon. With a second positive case confirmed at the Fredericton YMCA daycare, does this not qualify as child-to-child transmission?
I would have to look into that. Sometimes these cases are, every situation is different, so I can't confirm that. It could be that they were family members. They could have transmitted in a play date outside of that daycare. I don't have the exact details, but if we haven't said that there was transmission within that setting, then I can't confirm that. And I just need to correct some information around the long-term care staff that are vaccinated. So the 68.8% corresponds to the percentage of long-term care staff that have had at least 1 dose at this time.
Minister Cardy, would like to add?
Sorry, could you maybe clarify the answer that you offered?
Hold on.
Repeat it.
For which question?
Just about the second positive case at the YMCA daycare and whether that meant or qualified as child-to-child transmission.
I can't confirm that because every situation is different and I am not aware of the exact details. If there was child-to-child transmission, again, I don't have that information and it would be difficult to confirm at this time. Sometimes the transmission is because the children know each other outside of the daycare. They could be family members, they could be neighbors, they could have had a play date outside of that setting. So I can't confirm that at this time.
Before we move on to your second question, the minister would like to add something.
Just in relation to the previous question again, just to make sure it's out there, is in addition to 48 schools, so we've had a small number which have had a couple of cases, as I mentioned. And then we've also had 14 possible exposures impacting schools since last October. And since September, also 18 early learning and childcare centers that have also been impacted. And as the doctor had said, we've had multiple cases where we've had different people coming into schools who have had COVID-19, but they haven't transmitted the disease one to the other. So it continues to be the reason why we want to try and keep schools open as much as possible, because they're well managed and the staff are well trained and everyone's committed to doing their best to keep those ECE centers and the schools as safe as possible.
Mr. Cox, your second question, please.
So we asked a couple of weeks ago how many COVID-19 positive cases we have here from other provinces. Have you been able to track down that number?
I believe we announced that on a day-to-day basis with respect to separating out which cases are actually here in New Brunswick and which ones are not.
So whatever discrepancy has been clarified in the way this is being reported now.
Every day when we do either a press conference or have a press release, that information is contained in the press releases, is my understanding. It separates out which people are outside of the province.
All right, thanks.
Thank you, Mr. Cox.
That concludes today's COVID-19 update for the province with Dr. Russell and Minister Cardy. Now, just for a quick recap of the news we learned today, there are 10 new cases of COVID-19 in the province. 6 are in Zone 1. That is the Moncton region, and 4 are in Zone 3. That's the Fredericton region. Dr. Russell did mention there was 1 case of community spread identified in Fredericton. For the time being, the level of recovery is not changing. Vaccines are now available to New Brunswickers who are age 12 and over. So I'll be posting more information on that on our Facebook page as well as in a newscast for this evening. Thank you for joining me today. I'm Vicki Hogarth at the CHCO News Desk.
A news and public affairs production of CHCO-TV, New Brunswick's only source for independent community television.